All right, so this is our patient. He's a 26-year-old male. About 4 or 5 days ago, he was away at a hotel and was running down the hallway and felt a pop in his right hamstring region. He was able to continue walking and was able to enjoy the rest of his vacation, but still had moderate pain with walking. And actually, pain seems to have gotten worse over the past day or so. It seems like prolonged sitting makes him a little bit more sore and stiff. So on exam, he is tender to touch really in the proximal aspect of the semitendinosis region. He's got some mild swelling, but not terrible. He does have the ecchymosis, which you can see, but he's not tender over the ecchymosis. He's got good strength. He's able to flex his knee against gravity and against resistance with really no deficit. Ultrasound, just focus on where he's really tender, just see if there's any kind of large muscle tear. We'll try to get a peek at the conjoint tendon as well, and the semimembranosus tendon, just to make sure there's no tendon injury. He's not tender to touch over the ischial tuberosity, so I don't think there's any rupture or pull off of the tendons. So I think really he can just be treated conservatively, and he should do fine.
Here we're going to look at this region of tenderness in an axial view. Here we're looking at the proximal semitendinosus muscle, and we can see this black anechoic signal within the muscle itself where he is most tender, and this is again consistent with a muscle tear. Here we're looking at the gracilis muscle. You can see the underlying adductor magnus muscle, and now we're going back to where he's most tender in that semitendinosus muscle. You can see this black anechoic signal, which is right at the interface of the biceps femoris long head muscle, and this is consistent with his muscle tear, probably a grade 1 to 2, more of a grade 2 I would say, the fact that he does have this visible hematoma. Here we can see that Mercedes-Benz sign. We can see the sciatic nerve, the semimembranosus tendon, and the conjoint tendon is black from anisotropy, but you couldn't make out that Mercedes-Benz sign here. And you can see actually the semitendinosus muscle and biceps femoris long head muscles just abutting the conjoint tendon. Now we're switching views to a sagittal plane. You can appreciate this black anechoic signal at the underbelly of the semitendinosus muscle, which is again, I believe, his injury, more of a grade 2 type strain of the muscle. Functionally, he was doing fine, thankfully. And here we're looking at either the conjoint or the semimembranosus tendon attaching on the ischial tuberosity. I don't exactly know which one at this point I'm looking at, as it's a little bit hard to decipher. Conjoint tendon is more medial, semimembranosus tendon is more lateral. And in fact, it's brought down by Batterman that there are different facets on the ischial tuberosity, with the semitendinosus arising from the medial facet and the semimembranosus arising from the lateral facet. This patient was advised essentially just to take it easy, do some conservative management, perhaps some physical therapy, but certainly no surgical indication at this point.